Hi, my name is George Calixterio, and here is my ID, as you can also see in the slides. And here are the objectives of this presentation. I will discuss about chronic disease or condition, the complexities in managing the disease or the condition, and the role of nurses in managing the condition as I reflect on the featured video. What is a chronic disease or condition? According to the Australian Institute of Health and Welfare in 2024, chronic condition or disease is a significant factor to ongoing ill health, disability, and premature death. It is a long-term health condition characterized by their long-lasting and persistent effects. These long-term health conditions have persistent effects and are typically not immediate life-threatening but can reduce life expectancy, as noted by the Department of Health and Aged Care in 2019. Boersma et al. Noted that various diseases, such as arthritis, cancer, chronic obstructive pulmonary disease, coronary heart disease, current asthma, diabetes, hepatitis, hypertension, and stroke fall under this category. Due to the complexities involved in the management of this condition, it is considered as Australia's leading cause of illness, disability, and death, according to Health Direct Australia in 2020. Sources of poor communication, lack of holistic approach, limited consultation time, and disparities between urban and rural access contributes to the challenge in managing this condition. This is supported by the further study of Song et al. In 2019, saying that people in the rural areas are far from the physical access of some health providers, that they need to travel far, as well as find it hard to get appointment schedules, and at the same time considering their finances. For it all study consolidated all of these. With all these challenges, nurses play a role in enabling patients to optimize their self-management skills, according to Coates in 2017, which further explained by Galani in 2015 in her study that elaborated that nurses requires skill training, sound clinical judgment, and ability to develop and assess innovative interventions in the role to manage chronic conditions. This means that they will give support to their patients in their journey by giving education, self-management, and coordinated care. Video's content, it features Min Nguyen and Jane Mallon, a 43-year-old New Zealander diagnosed in 2008, discussing her journey with a chronic condition, a long-lasting condition as described by the Australian Institute of Health and Welfare. She shares her emotional tools such as frustration, anger, sadness, depression, and hopelessness, as well as the physical challenges, including her double knee surgery. Jane's story highlights that managing chronic conditions requires more than medication, emphasizing on the importance of the emotional and the social support. Her resilience and commitment to self-management are truly inspiring. Jane's experience with the interdisciplinary team seemed promising, aligning with the collaborative approach advocated by the Health Direct Australia in an article, stressing that collaborative effort is the best way to manage her condition. I believe that patients' active participation and their family involvement in the decision-making of the care is essential, as stressed by Coates in his article. However, in Jane's condition, in her case, she felt unsupported with her GP, prioritizing medications over alternative approaches, leading to more complications. The negative feedback from an allied health professional and her lifestyle changes further highlighted a disconnect between theoretical best practices and the real-world application. This underscores the importance of patient-centered care and active listening with multidisciplinary teams. Now, listening to Jane's testimonies, I felt disappointed and sad. Jane's experience highlights communication breakdowns and fragmented care, as explained by Joe's study in 2023, emphasizing on communication and coordination. As a future nurse, I have to make sure that these issues will be rectified. I will strive on the patient-centered care by actively listening and providing holistic care, including medication management, symptom monitoring, education and emotional support, promoting self-management skills, healthy lifestyle choices, resources access, and collaborating effectively with other healthcare professionals to build a strong and a trusting relationship. In conclusion, I can say that chronic disease condition presents a lot of challenges requiring holistic collaborative approach to effectively manage the disease or the condition. Successful care transcends symptom control, focusing on empowering patients by giving supports they needed to live fulfilling lives through patient-centered care, shared decision-making, and support system. And lastly, nurses play a vital role in providing comprehensive care that addresses the physical, emotional, and social dimensions of these conditions or disease. And here are my references. And the last one, thank you.